Sophia as well for inviting me to this meeting. It is unique. It's quite a unique meeting to actually have medical professionals, cancer survivors speaking at the same meeting, speaking about all the things that patients actually want to hear about, as well as including some of the professional medical topics as well. So I commend you guys. Doing a great job. We hope to someday emulate something like this here in Jamaica. So I just wanted to give a little bit on my background in terms of my expertise in this area with regards to taking care of the body, diet, and exercise after cancer. So I did my urology oncology fellowship a few years back. And in terms of my expertise on this topic, I can assure you that during that fellowship training, there was very little discussed. And I think it's really on that background of that epidemiology that I've been taking on over the last year or two, that I'm a little bit better able to speak to you on this topic. So let's begin. So essentially the presentation, I have a little area called In the Beginning, and then we're going to go right into some of the epidemiology of the effect of diet and lifestyle on cancer incidence and obesity, and then explore a bit of the actual evidence on diet and physical activity, and then we'll have a brief take-home message. So, in the beginning, I'd like to introduce to you a patient of mine. I've changed his name to random Mr. Smith, who I met in my first year getting out of fellowship. Diagnosed with prostate cancer. He was a 65-year-old, otherwise healthy man. And I performed surgery on him, radical prostatectomy, to achieve cure of his disease. As you can imagine, I just come out of my fellowship, so I was really feeling myself. I'd read everything. And I put this picture here with books, but in this technological age, I don't think I've opened a textbook, a physical. I haven't held a physical book in maybe 10 years. But essentially, I felt like I had read everything. I knew all the evidence, all the latest guidelines, new follow-up tests. So when he came for his first follow-up visit, I was thinking, all right, I know I'm going to follow him up. If he has any evidence of recurrence, what medication I'm going to give him. I knew all the new imaging techniques, breakthrough chemotherapy agents. We're hearing all about immunotherapy. It's also there for prostate cancer. Everything was right on point, and I was ready. So I said, ask me anything. He says, what should I eat now? That should I exercise? So I went on to say, you should eat. And it's a little trick for physicians, I'll tell you. When you see them take a deep breath and start humming and hawing, they really don't know the answer. Giving themselves a reader. So I said, eat healthy, eat a lot of fruits and vegetables, go do some exercise. But Mr. Smith wasn't fooled, and he started asking me some specific questions. So what kind of fruits and vegetables? How much of that should I consume? What is this thing about organic foods, doc? Tell me about this ketogenic diet I've been hearing about. Should I stop eating sugar? What's the word on juices, green juices, all these color juices? Should I steam the vegetables, eat it raw? Dietary supplements, alcohol, antioxidant, meats? What kind of exercise, for how long? And essentially, this was what I was feeling on the inside. I realized I didn't know any of the answers to these questions. And at first, I'll be honest, as a physician, we tend to think, or at least I used to think that, if it wasn't really described in the books, it wasn't discussed at all these conferences, it perhaps wasn't really that important. Maybe there's a bit of mumbo jumbo on alternative type medicine that I hadn't really taken on, I'll be honest, at that point. So I said, what would be my plan going forward? Should I just dismiss it and tell him just, go and eat some fruits and vegetables, go do some exercise? Or was I going to analyze the evidence behind all of these things? So that's what the bulk of the presentation is going to be on now. What is the evidence? Is there any truth to Dr. Google in terms of looking at some of this stuff? So we're going to start with one of the land-breaking, the huge studies that looked on, and this is by the World Health Organization, the International Agency of Research for Cancer, that looked on body fatness and cancer. They examined about over 1,000 epidemiological studies looking on if there was a strong or any association between obesity and cancer. And I use obesity as essentially an anchor point because we're exploring diet and physical exercise. And we do know that obesity is caused by taking in more calories than you're burning through physical activity. So a poor diet and limited physical activity could potentially lead to obesity, and then by that way potentially cancer. So it's just a diagram looking on links with cancer risk factors essentially. So tobacco, of course, is the leading cause, and that's the one in yellow. But right below it is obesity. There. Diet and physical activity are somewhere around here, but as I said, these two essentially combine or play a big role in terms of development of obesity. There have been many cancers linked to obesity. Breast, bowel, the kidney itself, prostate is in there as well, but there are big studies looking on epidemiological studies looking on the role of obesity in the development of prostate cancer. Not only the development, but patients who actually are obese, who have received treatment, they perform not as well as, receive the same kind of treatment, whether it's surgery or radiation. They didn't perform as well as patients who are not obese. The exact mechanism is unknown between the pathophysiology between obesity and cancer, but it's thought to be based on three different things. One is essentially that increased body fat leads to increased insulin resistance. So your body's producing a lot more insulin to drive that glucose into the cells. Insulin itself is a bit of a growth hormone, and it stimulates other growth hormones, and the thought is that it's going to cause increased cell division. And when you have increased cell division, you have the increased risk of dysplasia. So that's essentially one of those cells, instead of becoming a perfect copy of itself, becomes a little bit abnormal, and then that abnormal cell potentially continues to be abnormal, divides again, and it becomes potentially malignant. Another risk factor, or rather the mechanism hypothesized, is inflammation. And the thought is that increased body fat stimulates an inflammatory reaction in the form of cytokine production. Inflammation itself, once again, increases the risk of that dysplasia that I just mentioned. And finally, increased fats leads to increased estrogen production by aromatization. Estrogen being a bit of, I put growth hormone in quotation, but essentially it does increase the risk of cell falls, dysplasia, and cancer development. So this is our essential reality now. Over the last couple of years, there's here in the Caribbean, the developed world, we are suffering an obesity epidemic. And with that, these are some of the obesity trends in the US, continuing climb essentially. And in the Caribbean, we have not been left out, and ours continue to skyrocket. With that increase in obesity risk, we're also seeing a rise in cancer incidence. So I'm not saying that obesity causes cancer, but there's enough epidemiological evidence to suggest there's a strong association. So it's definitely something we can't ignore. So what does the evidence suggest? So to establish true causation is virtually almost impossible nowadays. There are long lists of criteria that have to be established or should be established prior to saying that this is a definitive cause. Something like smoking and lung cancer that's been around for 50, 60 years, and those strong associations, that is almost a guarantee that smoking causes lung cancer. Or that's the essential belief. In terms of diet, exercise, obesity, the epidemiological evidence is quite compelling, but the studies we don't have that strong level of evidence in terms of the types of studies that have been performed to definitely confirm. But just based on the association, I think it's enough information there to suggest that we should be a lot more concerned with obesity and the risk of cancer. So let's go on to answer some of these questions from Mr. Smith. Diet and cancer after treatment. So there's a few things that some of the survivors here should know, or they have lived this themselves. Survivors diagnosed with cancer tend to have decreased physical activity, whether it's secondary to the treatment itself, whether it was surgery or radiation, was it secondary just to essentially a change in their whole well-being. So they're depressed, they have more fatigue, they're stressed out. So regardless of whatever it is, there's a good chance that and the studies have supported this, they have decreased physical activity. They tend to eat poor quality diets, and they gain weight over the course of treatment. And this is noted especially in breast cancer survivors. Most important thing that has been, that is coming up in terms of looking on body mass index, obesity, and development of cancer and cancer recurrence is that you have to monitor your body weight. And we do this in two ways. You check your body mass index and check your waist circumference. There have been studies that suggest that there's a substantial increase just when you look on, especially your waist circumference. In a man, if it's over 102 centimeters versus a woman that's more than 88 centimeters. So this is now looking on a bit of food and the potential things of recurrence after cancer treatment, or when you're a cancer survivor. So there are many benefits to eating well. The data, as I mentioned before, is quite mixed on whether diet alone can prevent cancer from returning. And it's very likely the answer is no. It's very unlikely that just diet and exercise will guarantee that you won't have a recurrence. So there's so many complex factors, genetic issues, form of treatment, things like that. But I do believe that diet and exercise can help. And there is evidence to support that it can help you. Even if it's not in terms of helping you with recurrence of the disease, it helps in terms of your ability to fight the recurrence. Do you need further treatment? Your body's in a better physical state to withstand that treatment. And it's something we take into account, especially when we're considering other agents like chemotherapy and adjuvant therapies after cancer treatment. So all the studies and all the things we looked at, diets rich in fruits and vegetables and sparse in meat and animal fat have been found to have lower rates of cancer and cancer recurrence. Let's look on meats.